Welcome to the Clinical Data Informaticist series. Today's topic for you is, what is a radiologist? So my name is Ben Mervak. I'm an assistant professor of radiology here at the University of North Carolina in Chapel Hill. And I have no conflicts of interest. Our learning objectives today are going to be to define the field of radiology, describe some of the daily tasks for a radiologist, and understand how radiologists may generate medical data. So what is radiology? Radiology is a branch of medicine in which imaging is used to diagnose and treat disease. In general, this is separated into diagnostic radiology, which is the process of image interpretation, and interventional radiology, which has to do with doing procedures. Over time, there's been an increase in utilization of medical imaging, and radiologists are at the forefront of this surge in medical imaging. In part, this is because utilization is high because imaging offers a unique way to evaluate and track disease. So what are radiologists? So first and foremost, radiologists are physicians. And our training consists of 4 years of medical school where we learn to be a doctor. We then go on to radiology residency, which takes 5 years. You learn to be a radiologist during that time. And then most radiologists will go on to do a radiology fellowship, which is 1 year long. And that's where you learn a subspecialty of radiology. So radiologists are also diagnosticians. We spend most of our time viewing and interpreting a wide variety of imaging examinations to make medical diagnoses. For example, we might look at a head CT, a chest X-ray, an abdominal ultrasound, or a knee MRI. We can use multiple modalities to create images. And these are some of the types of what we call modalities. So we could use X-ray or fluoroscopy to create images. We can use mammography to image the breasts. We can use ultrasound, computed tomography or CT, magnetic resonance imaging or MRI. We can use nuclear medicine and positron emission to create PET studies. And then you can inject contrast into vessels and do angiography. But no matter the modality that you use, we're still looking to diagnose medical diseases using those images. Within the US, radiologists are mostly divided into subspecialties by their anatomical area of training and expertise. So neuroradiologists are trained to evaluate the head, neck, and spine. Cardiothoracic radiologists evaluate the chest and the heart. Abdominal or so-called body imagers evaluate the abdomen and pelvis. Musculoskeletal radiologists evaluate the extremities and bones, and mammographers evaluate the breasts. There are some radiologists that function across disciplines. So pediatric radiologists do all kinds of imaging for kids. Vascular interventional radiologists, as I mentioned, do procedures. And nuclear medicine radiologists will image multiple body parts and focus in many ways on oncologic imaging. So unlike other doctors, very few radiologists see patients. Nonetheless, we have an important role in clinical medicine and steering patient care. Some people refer to radiologists as the doctor's doctor. And what that means is when a patient doesn't know what's going on, what's going wrong with them, they may go to see a doctor. But when a doctor doesn't know what's going wrong with a patient, they may refer to a radiologist for imaging to help us decide what's going on with their patient. So radiologists, although they don't see patients directly, we do play an important role before, during, and after a patient's visit. So before a patient comes to the hospital for imaging, we might have a call with referring doctors to guide them in selecting what type of examination to order. We also write and select an imaging protocol for our technologists to follow when they're actually creating the images of the patient. During a patient's visit to the hospital, we might troubleshoot artifacts that using our knowledge of physics of imaging. We may have to check images to ensure that they are of sufficient quality. And we might also have to care for the patient if they're in the department, if there's something that theoretically goes wrong. Following a patient's visit, we dictate a report for referring clinicians and is also used for patient viewing. And we can also provide follow-up consultations to physicians to guide treatment. So what are the top 3 daily activities in a radiologist's daily life? So number 1 by far is to view examinations and dictate reports. This is probably more than 90% of how we spend our time. So as you see here, we review images, usually on a computer, on a workstation, using an electronic PACS system. And we kind of catalog expected and unexpected findings that we're seeing. We dictate a report, usually using some sort of voice recognition software, and we document findings for publication in the electronic medical record. We also, as we're doing this, are checking images for quality to make sure it meets quality standards. Number 2 is communication. So we have a lot of roles as communicators of findings and also providing advice. So we make a lot of phone calls each day. One of the common things that we make phone calls about are fielding questions like, what examination should I order for this patient? You know, say a patient has right upper quadrant pain, what's the best study to order? Number 2 is when we're looking at an examination and we see something important, we may have to make a phone call to say, hey, your patient has a pulmonary embolism or aortic dissection or some other finding that we need to communicate to the doctor that's referred the patient. And finally, we might have to make a phone call to say, you've ordered a CT with contrast, but I would actually recommend an MRI for this indication. So those are some examples of the communication that we might do each day. And finally, we perform ancillary tasks for patient care. We spend a lot of time reviewing a patient's medical record. When we're looking at their images, we might be curious whether they've had interval surgery or chemotherapy or some other medical procedure. And we also consult at multidisciplinary tumor boards where groups of doctors of multiple disciplines get together to discuss a patient's case and come up with the most appropriate treatment regimen for them. So do radiologists see patients at all? Well, some do, namely interventional radiologists see plenty of patients. This is an example of an interventional radiology suite at our hospital. Interventional radiologists will do things like insert catheters, do organ biopsies, or do vascular embolization or stenting. Mammographers will also see patients. They do things like breast biopsies, and they'll also consult with patients when they're undergoing mammography, particularly if there is a finding. And then all radiologists will see patients when imaging complications arise. For example, if a patient was over-sedated for an imaging examination, or if they experience an allergic reaction to contrast. There are some differences between private practice radiologists and academic radiologists. So private practitioners usually spend most of their time on those top 3 activities that we talked about. Academic radiologists have a few additional things that they do. So for example, teaching, we might teach medical students, residents, PAs, or technologists during our day. And we may also do research. So we might look into novel imaging techniques, do clinical research, or even dabble in artificial intelligence. So how do radiologists create and interface with medical data? So some of radiology is kind of a one-off diagnosis using imaging, but a large portion is tracking diseases over time following therapies and treatments. Imaging, particularly when you do it over and over time, can generate large amounts of medical data. This can be in the form of images, measurements, segmentations and overlays, or even in a text report that lends itself to natural language processing. This can be assisted by things like structured reports and standardization. So in conclusion, radiologists are physicians that guide patient care using medical imaging. Imaging interpretation and report creation is the majority of a radiologist's day. And radiologic data may be obtained from images, annotations, or report text. But thank you for viewing this session today. We invite you to connect with us either on social media, our website, or particularly by joining us at the SIIM annual meeting or the Conference on Machine Intelligence in Medical Imaging.